Thank you for having me.
Absolutely, absolutely.
It's not often, it's funny as a psychologist, right? I'm so used to listening to other people's stories. It's not often that I'm asked my stories. And even as I was, thinking
I mean,
about
you
what,
should.
isn't that interesting? Want to know. It's always the biggest compliment to me when a client says, gosh, I wish we could just go sit and have coffee. Like, I just want to spend
Right,
more time with you.
right.
Always warms my heart. So I'll start there. I'm a
That's
perinatal psychologist, and I have been practicing for close to 20 years now.
wow.
It's wild. I think I have 4 kids, all in a very different phase of life than your kiddos right now. So my youngest just had his bar mitzvah, so they range
So,
13, 15, 17, and 19.
oh wow, the whole other end of the spectrum right now.
Whole
Yeah.
other end. But it's interesting because something that you may have noticed already yourself is that as soon as those kiddos join the mix, everything gets reoriented around them,
Yep.
right? So as
Yeah.
I was thinking about how long I've been practicing, I was like, well, my oldest was 1 or 2 when I was studying for my licensing exam, and he's 19, so yeah, okay, close to 20
So there
years.
you go. Yeah. Whew.
And I think my story in a lot of ways is very traditional in how I got into the perinatal world, which is I started having kids. And, my husband and I, we get to work together.
Oh,
He
nice.
is a prenatal chiropractor, so we have a holistic wellness center together.
Perfect.
Both transplants from the East Coast, migrated more and more west as we did graduate school and internships and things like that, which is such a fun adventure at the beginning. But then you start having kids, and then you say, gosh, I'm on my own here.
What am I doing right?
Seriously, right? We didn't have the family circle or bubble of help, which, double-edged, but we didn't
Yeah.
have any of that to even draw on. And it was really that said, that sent me into that path of like, there's got to be more to support families.
Yeah.
We're not the novelty in such a transient society anymore. And so it's like everyone's like, well, the village is gone. I'm like, the village isn't gone. It's just changed.
No. Yeah.
So it was really when we had our kids that I started going into perinatal psychology and how to help people with the transition to parenthood.
Yeah.
And that became my focus clinically. You can't, unfortunately, spend time in this field, in this area, without recognizing that a lot of trauma comes up for people when they have kids.
Sure. Sure.
And so I went back for, a number of different specialties in trauma work as well, which informs the work that I do.
Yeah.
But so work as a psychologist, have 4 kids, have 2 fur babies. The kids canoodled us into a second fur baby this year. A whole nother story.
Clever, right? Clever.
Oh, yeah. And then I launched a cookbook this year. That was definitely the baby of 2023 of publishing a cookbook. And those are some of, I love horseback riding. I love hiking and being outdoors. I had the wonderful opportunity of homeschooling my kids for a few years. So we wanted to do something different.
Yeah.
My oldest, and in private Jewish schools, when the boys get to a certain age, they often will throw a Sunday school program into the mix.
Yeah.
And I was like, nope, you can't have him. I'm like, enough, too much school. And we pulled them and we homeschooled them for 2 years. And that was really where we discovered a lot of those hobbies and just doing activities together.
Yeah.
Like horseback riding and cooking and hiking and things like that. So those are some of the fun things about me.
And did the cookbook stem from that, or has that always kind of been one of your like other passions? It's just kind of like bloomed into it.
It's so funny because when Elliot and I were in graduate school and we did grad school out in Atlanta, it was always like our fun activity. So school was so cerebral, and then the kitchen was my fun creative place.
Sure, yeah.
And he and I would take classes together, and we would do cake decorating and sushi making and all of these different things. And it was how we prioritized dates while he and I were both in rigorous programs. And it always felt like a separate, kind of like track in my mind. Like, I'm a psychologist by day, but like this was the other piece of it. And then the more and more I delved into, writing the cookbook and creating it, the more I realized how much synergy there really is with both sides of me, right? Like, how did those come together? And it was cool because the more I spent time in that path, the more I discovered that there's a whole beautiful art form called culinary therapy.
Yeah.
Where people don't realize that the kitchen, we know the kitchen is often the hub of the household. We
Yeah.
don't always realize that the kitchen's also a great place for teaching and
Yeah.
bonding and practicing different, great life skills like organization and time management.
Yeah.
And so it was a lovely merging of more of that clinical side and that creative side into this
Kind of
very
coming
much
together. Yeah.
passion project. Yeah.
Yeah. And you could, so looking at our own kids and just, Montessori philosophy altogether, that's you use a very key term there, those life skills. And that's the focus. And for what you just said, that there's so much that you can learn in just the basics. And, we have, like I said, we have a 2-year-old, and for a long time, like, he's had a little help tower that puts him, high enough, and it's increasing levels of like what he's capable of doing, like us, allowing for him to do. And then on top of that, like his own independence, to the point that you've got his own little knife, and he wants to cut the cantaloupes, the avocado. But you can see that, and it blossoms into he's pouring his own syrup. That what you just said, that like we're looking at it as maybe as parents, and you can chime in and correct me if I'm wrong, but that's a messy area, and I don't want to do this, and I don't want don't touch that, but if you just stop for a second, how calming is that? Just an activity, just to be in there and have them at such a young age to be part of what should be like a moment of like family and gathering, and not just a chore to like, okay, I gotta put food on the table, right?
For sure. If we think about like the buzzwords of like today's generation, if you will, it's grounding and mindfulness. Well, the kitchen is a bevy of that.
Yeah.
Right? The meditative vibe of washing dishes in warm, in warm water, or like you said, chopping. And everyone's into the cool, the cool sounds, and like the cool, sounds that like, chopping celery makes. And yeah, we are very much in line. We've had kids in the kitchen from the very beginning. I don't think there's a Food Network game that we haven't created or redone in our kitchen. And like you said, always with the fun of, making the mess and just exploring. And mess is just part of life. Yeah.
Absolutely.
And it's amazing. My now 13-year-old, when he was 10, actually combined kind of, parts of me and my husband, and he started a food podcast that was born
out of
my husband has a podcast, right? Informed Pregnancy has been his baby, and he's like, that's cool. And he's been in the kitchen with me and loves to cook and eat and, be my little taster. And he's like, well, I really like that.
Why not?
Yeah. And it was amazing.
Do it. Exactly. Amazing. Right. It's allowing that exploration, alleviates so much of the pressures that's on a kid, at any age. And then if you really like let yourself do it, you're the parent as well, that it's like, it's just avocado on the floor, it cleans up, like it's not like a compassion, control, right? And if you can just allow yourself that for a moment, the whole world opens up. So go back then to when, as you began to, to see that this is like the area of expertise, career-wise, that you wanted to do. What moments or moments, kind of informed that like, okay, there's a real conversation that needs to be had, perinatal psychology, and just, the whole conversation from day one, conception on down to, how parents are and what that relates to like a child's mental health as well.
Totally. And JD, if it's okay, before we even jump there, I just want to throw in, like, when you have little kids, right? I'm already on the other side, but when you have little kids, like, the fear of the mess is real, right? Like in those early postpartum days when there's so much to do, and the thought of avocado on the floor is like, it's kind of putting me over the edge. I want to, I want to identify, like, we get that. That's right.
Yeah.
And so for people who, let's say, have either a family member who's going to come help, or maybe you have some housekeeping help coming in, you can also choose those days wisely. Like, it doesn't have to be an everyday, but if you know someone's coming to help, let that be the morning that you have the big mess.
Yeah.
So you can also kind of leave with your child, right? Or assuming you can't bring them into the cleanup kind of thing. So I want to make sure that we're talking about, those mamas who are like, no avocado on the floor, I can't handle
it's okay.
it.
It's
and
okay.
that's okay. And,
Yeah.
finding those moments is important.
Yeah. Because it
Um,
does translate. I mean, I very quickly like saw that, with our son and we have an 11, well, soon to be a year-old like daughter. But with him, it's very evident, very early on, like if you, which you want him to clean up right eventually, but it's like you can see them pick up on even little things like that. Like it's, you kind of pause and you're like, "Ugh, I should have made a big deal about that. It's just a tiny little mess. Why don't like it gives you a moment to learn too if you really just let it. But then you don't want, in the end, you don't want them to be that picky about something. They're really that young. Like you have to let go if you want them to let go and learn that lesson to just be right and enjoy.
that's right. And for people to know that that is definitely the goal, and to know
Yeah,
that it's a journey and it takes time, right?
absolutely.
And that, once we're jumping in, and then I promise we'll go back, but if we think about attachment, right?
Right.
Attachment, so we bond with our kids, and our kids attach to us.
Yeah.
And I want parents to know in those moments that perhaps we're not as calm as we want, attachment is never about being perfect. It's always about catching and repairing. So
Yeah.
if you have that moment where you're like, oh, I shouldn't have made such a big deal, that's okay. Comment on that, notice that, talk to your child about that, hug it out, right? Repair that moment, and then we keep going. And then hopefully, like you said, over time, we're able to, and really I think the key is slow down, right? So that these things can
Right.
be
Right.
softer moments. It's really hard. I mean, we're working at such a Mach speed on so many different levels that, if we can try to tap into our child, right? Our child is so in the moment. They are the
Right.
perfect teachers of just like, I'm just here with you. I'm not doing
Yeah.
something at the same time, right? And so they can, like you said, teach us as much as we're
Yeah.
looking to teach them.
Yeah.
Um, but yeah, they're so special and amazing. I mean, I know we romanticize the baby stages and they're wonderful. They're so yummy and cozy, but every stage is just incredible.
Agree. It's that sometimes it takes a little bit more to find that, like you've got to weed through some of those challenging moments and realize they don't know the world like you do, and they don't know how to express it or feel it, and this is it, So rather than be upset about it, like pause. What are they saying? And then it's like, oh, it really is a fun moment in here. He's screaming and crying, but this is a good moment, actually.
A good moment and a wonderful moment to regulate
Yeah.
that nervous system and know that
Yep.
he's not going to shove it in like, us adults
Right.
do. And so when he comes out on the other side, it's really going to be done, right?
Yeah,
Nothing's
he
perfect.
has no clue. Like you're still talking about it. You're like, wait a minute, what?
Oh,
What?
yeah.
You're talking about baseball all of a sudden? You were just, I don't know. You're right.
Yeah,
You're right. I should stop too.
totally. Totally. We need to figure out how to catch up. Totally.
Yep.
But, I think that the thing that really informed for me moving into this space was I had heard, I think I experienced with my oldest, but you hear so many people say there's no manual, right? There's no
Yep.
manual for parenting. There's no manual for postpartum. So you just have to jump in and kind of like hope for the best. And that's crazy. We don't live really in a jump in world in
Yeah.
2023. We plan the minutia of our day. I mean, we
Yeah.
plan to plan things. Yet, and pregnancy is no different. We plan every
Yeah.
part of our pregnancy. We've got the giant journal of when we're going to do what. We've got the year list of how we're going to,
Yep.
what we're going to buy and how we're going to set up the nursery. And somehow we have baby and then it's like, what? Got
Gone.
nothing.
Done. Yeah.
And I'm like, nope, not having it. So I actually
No.
created a manual or I
Yeah.
created a workshop because I'm like, that's ridiculous. Postpartum or perinatal depression is probably the number one complication in childbirth.
Sure.
And what's partly so devastating is that there's so much of it that's preventable. Not everything, not always, but there's a
Yeah.
lot we can do to
A good
prevent or
chunk
at
of it.
least mitigate if we talk about it
Yeah.
and if we plan and prepare. And so the afterbirth plan is a workshop that I had created to really, like you said, have that conversation of,
Yeah.
gosh, let's talk about what happens after we have a baby. Instagram is wonderful about telling you all about those picture perfect moments, but like when the camera stops and the mess does hit,
It's not bad. Right?
yeah. And here's the thing, when we go into something with a certain expectation or vision and it doesn't live up to that, all of a sudden we feel like we were sold this false bill of goods. And
Yeah.
I'll hear people say like, it's not what I signed on for. It's not what I thought it was going to be. And that to me is so devastating because
Yeah.
I want you to know what's going to happen, and they're going to be incredible moments, and they're going to be hard moments, but hard, meaningful moments, right?
Yeah.
That if we can navigate how to work them through, really help us in our development as parents, help us in our bonding and connection with our babies,
Yeah.
and help create and cultivate a wonderful environment for them to grow and develop
To
and
grow.
flourish.
Yeah.
So hard doesn't have to be bad, but we judge it.
We do. Why do you think that is though? Like a conversation, like, I mean, even like, during pregnancy or, like up to it, like you kind of like, hear those, and I'm now as a parent, I just laugh at the stories and I'm like, well, you're probably not getting any sleep. Like, oh, this must be a challenge. Like, it is if you want it to be, but I'm not staying up till midnight watching Netflix. When my kid goes down, like, I know that if I want to get sleep, now's the time. So it's like all those things that we talk about and like kind of like laugh off. And like you said, like you see the pretty picture, the pretty moment, or read the article that's like, this is how it's gonna be. Just do this and do this, and it'll be roses. And it's not. You like, you're immediately upset and immediately like, oh, I'm a terrible dad. I'm a terrible mom. Like this is awful parenting. Like all those things. But why do you feel it's not a conversation that like nobody wants to have, like to let you know, like just flat out that yeah, it is challenging, it's gonna be
Right.
hard. Why do you think that is in this society?
And I think you hit on it first and foremost when you said, when you talked about the desire to be the perfect
Yeah.
dad. I think that for a lot of people, this is a part of life where they just want to, succeed. And
Yeah.
anything that seems to deviate from good or easy or normal somehow feels like I failed
Yeah.
or I'm not doing it as well, right? I also think that we really need to create somewhat of a cognitive shift because
Yeah.
we live in a world so often where it's this or that. And so that leaves you with these polarities. And either I'm not getting sleep and I'm struggling, or there could be a good moment. And so
Right.
I often work with clients to be able to shift it, right? Because little in life is this or, most things are this and,
Right.
right? Sleep will change. There's no denying that,
Yeah.
right? So we want to also reframe how we think about sleep. And maybe we're thinking about sleep not like I have my day and then can I get my 8 hours at night? And now I'm thinking like over a 24-hour period, can I get the sleep that I need to feel like I'm able to function, right? So sleep changes.
Yeah.
And there are going to be awesome, sweet moments where
Right.
I'll hear women and, parents sometimes talk about, yeah, it's hard to wake up at night. And there are these really cozy moments where it feels like it's just me and the baby. And
Yeah.
we're the only ones in this world, and it's just sweet and yummy, And so there is the potential for both.
The
Now,
balance. Yeah.
for some, that could be a hard moment. It could feel lonely and isolating, right? But there's potential for both.
Both.
Something can be hard and it can be beautiful.
Yeah.
The other thing that I think is really hard for people is change is one of those things that we like to pay lip service to. Sure, I believe in change. You change.
Change is good.
Yes, change is good for you, JD, not so much for me. Right? We believe in it as a construct.
Yeah, absolutely. Right.
Do it outside of us. Oh, you wanted me to change? Oh, I don't know about that.
No, right. Yeah.
That feels scary. But if it's so long, I know how it will look.
Yeah.
So
That baby needs to go to sleep. I've got to do this. Like they can
right. Or that baby needs to
change.
right? And so that also becomes, I think, one of the
Yeah.
harder parts because you're now finding yourself in a situation where it's unavoidable. Change is going to happen. There's a new person
Yeah.
in this family who has very different needs and wants.
Yeah.
And, it's hard because of like we were talking about, in terms of people's perspective on change. And then the other part is for a lot of people, the contrast is so stark because, you go from a life where you know exactly what's expected of you. I show up at my job. I know what to do. I know what the tasks are. And there really is a pretty stark learning curve of like now so much is new all at the same time.
Yeah.
Right. And again, if I haven't done anything to prep or prepare, and if I haven't had experience with kids, I don't even know what the swaddle thing is that people keep talking about, but I'm supposed to do it, right?
Or not do it. Or wait a minute. That one said yes. This one said no.
Yeah.
Yeah.
And so I think a lot of these things kind of feed into why it is the storm that it is.
Yeah. like I said, I saw it at least like quickly, um, and thankfully, wife and I are, I wouldn't say like the most like emotionally strong, but strong enough to realize like, okay, like I'm way too upset about the fact that, he's not paying attention at, dinner. Like he's having a hard time. Like, like you can see that. But I also like quickly am also, I put myself in other people's shoes and I'm like, man, like if I weren't me and like don't have an awareness, not even like a control or a management over that thought and that feeling, like how does that person, how do they deal with that, and then what are they looking up and how do they, it's like feeding all that in. I can remember when our son was born at a very great hospital and a great, medical system here in Durham. And actually, they were both born in two different hospitals of like high caliber here in Durham, Chapel Hill area. We'll let people figure that one out. But two great hospitals, one private, one public, two, well known. They had the same conversation exiting, that it was like, here's our little piece of paper so that we can tell you that we can say that we asked you if you were okay. But I don't remember doing it with our daughter, and maybe it's just because it was like, we've like seen this kind of thing before, but I can at least remember with our son that I was filling it out for my wife if she was doing something else, maybe feeding him or whatever the case was. But I'm, well aware of like how she would respond to these questions. So I know she wasn't being untruthful, but
Sure.
something, it was like a question about something like, in the last, I don't know, like 6 hours, some small frame of time, have you felt sad or cried or something else? She's like, please don't check yes, because I know what that's going to mean. And I'm not like, of course I felt that way. Like I just had my first child, but for starters, it was a very, very basic, generic question and bland. But how many times do people don't have that awareness like she did, and me understanding that she's not
Totally.
kidding? Like if she really felt that way and she needed help, she would. But how many people are just kind of like, okay, well, I'll just fill this out and get on. Just like the hospital was like, just can you fill this out and get on? But really, they're going home, like you said, in this panic state of mind that it's like, oh my gosh, like I don't have a manual. They gave me a manual. There's nothing on the pages, how many times they're going home and just really did need more support. And we just kind of left it to be what it is. I don't know.
Yeah, and it's really interesting. First of all, I'm sorry that they didn't ask after your daughter, because
I think they did. I just don't remember that specific type of paper. And maybe she filled it out because it was all part of one. And so kind of
sure.
knew it. I'm sure they did, but it was not so like in my head, because it's the second time around. I don't know, but like I was very aware of everything with our son because it was all new. But
Absolutely.
even I looked at that question out and in the whole form, like, this is ridiculous. Like, this is your making sure that like postpartum wise, like mental health wise, like the mother is
Yeah,
okay. Like, that, and forget the fact that like dad's going to be like, not so great maybe later on, it's like
totally.
gone. So no, it was very interesting.
And first of all, I am grateful that hospitals are starting to ask,
They are,
because
yes.
it is progress in that it wasn't, historically it wasn't even a part of the discharge
Right,
process.
right.
So I am grateful that we're starting the conversation and that hospitals are asking. There are definitely different tools and measures that, different, institutions are using, and some of them are
Yeah,
better than others. It's also so hard and difficult because, like you said, to ask the questions but do nothing with it,
yeah,
is devastating, right? And for it
yeah,
to feel like it's not something that I'm actually listening, but like you said, can you just check off this requirement for me so I can, discharge and file my paperwork?
yeah,
It is much harder. It's also really hard. I think what's so hard about um, illnesses in the postpartum period, or being able to detect them, is that there are certain symptomatology that overlap, right? And how do we differentiate, like your wife was indicating, right? What's the normal emotional
right.
release or upheaval or change or just fluctuations that happen because, hi, I just had a baby,
Yeah,
versus something that crosses that threshold into more concerning,
right.
and it's hard because what we see is, for example, usually within 2 to 3 days after having a baby and lasting for 2 to 3 weeks, that's actually the time period of what we call the baby blues. And, baby blues is that just the change, the fluctuation, the recalibrating of your brain. Women will tell you, I don't feel grounded or centered. I kind of feel all over the place. Little things seem to be getting big reactions, or I feel like I'm crying at the drop of a hat. And that's normal. Upward of 80% of women will experience baby blues, right? And anything that 80% of the population is experiencing, right? And it makes sense. This was massive, right?
Yeah.
And it was massive emotionally. It was massive physically. It's just a big deal. And so it would be nice if the hospital did more than ask a few questions and send home some actual literature and information, especially knowing that there's that difference between that
right.
and, after that. And so something that I do a lot is work with OBs, obstetricians, and midwives and pediatricians to really keep that conversation going, because you discharge from the hospital and pretty much that's it. And, there are OBs that they'll even say, I have this wonderful OB in LA who came to me and said, I want to do a class in my office because I see my patients at 6 weeks. And he's like, it's a fast visit. And then that's it. And it's like, we're not supposed to have more contact. I've helped and nurtured them through the entire pregnancy. And then I see them 6 weeks and then I'm out. They've had my number, throughout pregnancy.
The whole time, right, yeah.
They don't know that they can use it postpartum. He's like, no, that's not okay.
Yeah.
Right? And so it's really working with the obstetricians and the midwives and then the pediatricians more than anything, because you're going to see that pediatrician 2 weeks, 4 weeks, some are 6 weeks, definitely starting once a month. And for them to be the ones that are continuing to ask. And where you also know that they're, not like, and again, our nurses in the hospitals, they work hard, they have a lot to do, but they're not asking as they're walking out that front door, right? The pediatrician who's sitting down and talking, and let's talk about your baby and let's talk about you.
Right.
It's really helpful. I'm always a big proponent that a great pediatrician recognizes that, the birthing and non-birthing partners, moms, dads, whoever, are just as much the patient as the baby. And so if they understand that, great, we can work together. If you're kind of not really entertaining or listening and supporting what I'm needing as a parent, you're not the right fit for me.
And you see that too a lot. You're right. I mean, it's a quick conversation, like 15 minutes at best, and it's focusing on, that form is all about whatever milestones. And there's another, yes, you want to see those things, but it's like there's another added like weight and pressure, like mentally for, parents altogether, like they're not doing this yet. Like, what does that mean? And nobody, you're right. I mean, nobody sits to explain. Nobody has the time to sit and explain, but, you left them with this. But yes, their vitals are good and, like they look great, but it's like, hold on, like how do I do this? How do I go home and do that? And then you're stuck down a rabbit hole of, this is how I did it with my kid. Yours should work too, and no, right?
And I did a class last week at an OB's office, and it was pretty much 3 hours just talking about preparing for postpartum. And most of the feedback was great. This was informative, things I didn't think about. But it was so interesting to me because there was one person who said, too much, too fast, and I needed it more simple. And it really just occurred to me like how deep the need really is. That here we're kind of, doing as much as we can in that time. And she's like, no, I need more. I need more. I need it simpler. I need more information and more examples because, I don't have this coming from any place else. And so, JP, thank you for starting the conversation. Thank you for highlighting this for everyone.
I mean, it's just, like I said, it's something that resonates with me anyway. Just, it's important. It's important as a family anyway, like, to talk about those things. And you can see it already. I mean, like, and I didn't know this until the other day. Mom is the director of the school that my son goes to. So that helps, to ask a different like set of questions or to get it in not so fast way. Our son on the way to school randomly, hey daddy, what does daddy do when he feels sad? And I'm driving, I'm like, what? But we talk about like that hurt that hurt daddy's feelings, that hurt mom's feelings, like daddy feels, and not that I'm gonna like constantly tell him like, dad feels sad, leave me alone. Like it's not that, But he is hearing, though, lo and behold, they did have a conversation about emotions at school. But he took that to a whole nother level. But so long before all that, like you see it, and it's like, how are we not having that conversation?